Governor Ron DeSantis appears to have backed off a little from his stance about the COVID vaccine for young children.
He's the only governor in the country who did not order the new vaccine for kids. Today, though, he's no longer standing in the way of doctors who want to get it. CBS 4's Joe Gorcho is live in the newsroom to explain what's turned out to be a great deal of confusion. Joe?
Well, here's the thing. The Florida Department of Health contends the state never reversed course. They say the plan was always to wait until the first day the federal government allowed official orders from health care providers to get the vaccine. The department says that's today. The governor did not specify that plan in his remarks yesterday. Pediatrician Dr. Lisa Gwynn is the president of the Florida Charter of the American Academy of Pediatrics. She encourages parents to talk with their doctor to decide what's best for their child.
I do think it's safe and it's effective, and it's the only way to really protect children against the COVID virus.
Dr. Lisa Gwynn says she will recommend the vaccine to all her patients. She stands in stark contrast to Governor Ron DeSantis' stance.
The risks outweigh the benefits, and we recommend against. That's not the same as banning it. I mean, people can access it if they want to.
He said that on Thursday. Dr. Gwynn says the order for COVID vaccines goes through the state. So before Friday morning, healthcare providers had no way to order doses to give to the youngest age group.
Florida's children will have to wait the longest to get their COVID vaccine.
DeSantis also said the state has a surplus of COVID-19 vaccines. Dr. Gwynn says the surplus would not help children.
It doesn't work that way. The doses, the actual vial is different. The dosage and the milligrams are different in both the 6 months to 5 years of age, then 5 to 11, and then 12 to 17.
What has been the most frustrating component about waiting to place in order to get vaccines into your office?
You know, they're not listening to the medical experts and the data and what the pediatricians are saying. You know, that's what's most frustrating.
After the green light came, she says her office ordered 7,500 doses. Jackson Healthcare System said, "We are in the process of trying to figure out a plan for this age group." DeSantis also said on Thursday that children have practically zero chance of COVID complications. On Friday, Rep. James Clyburn, chairman of the Select Subcommittee on the Coronavirus Crisis, called the governor's comments dangerous.
For decision-making like this to be based upon stuff that just ain't true. To be personal in one's belief is fine in one's own private life. But when you hold a public position, decision-making ought to be done in the best interest of the public.
Now, Congressman Clyburn sent a letter to the governor urging the state to order vaccines for younger children. He waits to hear back from the state in their response to that letter. The governor again saying Thursday there would be no state program to administer shots to the youngest age group. Joe Gorcho, CBS 4 News Tonight.